we have to talk about how versatile it is when it comes to the processes and innovations. And for exactly that, we have Dr. Mahesh Hukmani here to present his views to this August gathering about preventive healthcare, new diagnostic tool for disease prevention, voice analysis.
Good morning all the delegates and the fraternity of medical profession, as well as the Times Cyber Media. I'm really grateful to you for providing me this valuable platform where I can share with you my research work and my knowledge. A very short introduction about me. I'm Dr. Mahesh Hukmani, and I've been practicing eye surgeries for the last 15 years. I did them actively for 10 years after passing my MS examination, and went into the field of vibrational medicine and came up with a new system of diagnosing based on WHO guidelines for disease prevention. It helps in early accurate diagnosis, as well as it displays the stage-wise progression of a disease from mind into the body via blood. Now, this is a work of research into clinical practice for the last 5 years, treating more than 2,000 people, implementing on them, and we've got really good results in these 5 years. People's lives have been transformed. They don't fall sick anymore. This work is still a matter of research at MIT, USA. Sonde is a company with still under research with MIT, USA. They are still exploring the possibilities of using voice analysis as a system of diagnosing coronary artery diseases earlier on. Then there are a few more companies which are involved in research work for making voice analysis applications as a diagnostic tool to diagnose diseases earlier on. We have launched this system 5 years back in India. It's entirely made in India. We have launched this voice analysis application 2 years back, tested clinically, and with good results. So why do we think of disease prevention? Why is it necessary? Because we want to contribute to the economic growth of our nation. Any nation with healthy population is expected to grow faster because most of the people who are healthy are contributing to the development of the nation. That is why we want a sickness-free society, for which we have worked. The idea or thought started way back in 1984 with WHO convention in Geneva. It's called 1984 Geneva Convention, wherein certain guidelines were laid that would be helpful in diagnosing a disease early on and also for disease prevention. We have worked extensively on these guidelines, and we have come up with a system wherein there are diagnostics, wherein there are treatment options, and wherein there are results. I heard somebody say health is wealth. Yes, indeed it is. But to me, it's a misnomer. Until and unless we renamed it as preventive health is wealth. And I think most of us would agree with that. It involves only a small 30-second voice recording through a calibrated mobile phone application or a laptop mic. That's it. And it's a full body scan. What you get with this voice analysis these are the vibrations of the vocal cords. These vocal cords are connected to each and every system of the body. Every system of the body expresses its frequencies through the vocal cords. There are frequency associations, representation of each and every organ, system, blood element, or emotion when we speak and when we record this voice. Total 72 frequencies are mapped in each voice, spread across 12 major systems in the body, whether they are at the emotional level, whether they are at the level of blood, or whether they are at the level of the physical body. Now, when you can diagnose a disease at the level of root cause, which is the stage number 1, the inception of a negative emotion into the subconscious mind, leading to a pathway First four stages are at the level of mind, fifth spills into the blood, and sixth goes to the physical body, where allopathy, and my dear all colleagues, you diagnose through by way of CT scan, MRI, USG, and other means. So there is a system now which can be utilized for disease prevention, and we have utilized it very effectively for the last 5 years. Current module is like you record your voice, it is sent to the server, and everything is manual. Voice generation, voice analysis reporting system is there, which tells you about each and every emotion, how it will progress in the body, what are the changes which are going to happen at the level of blood, whether it is a neurotransmitter imbalance, whether it is a hormonal imbalance or protein, vitamin, electrolyte, minerals, ions, whatnot. Everything that you do by blood test is now possible through a voice analysis. It is, so I'm very happy to name it as a non-invasive complementary diagnosis tool for the medical fraternity. This can be incorporated at the level of corporate hospitals. This can be incorporated at the level of primary healthcare centers with little intervention and effort from government. Organizing preventive diagnostic camps is the key, wherein you record a patient's voice and you tell him where exactly is the disease lying. Is it at the level of mind? Is it at the level of blood? Or is it at the level of the body? And then you divide these patients into different categories, whether you want to give them counseling for emotional issues, whether you want to give them certain lab tests for certain deficiencies which are highlighted at the time of the reporting, or whether you can, whether you would like to refer them to a particular super specialty or a specialty clinic for further management. Setting up of these preventive healthcare clinics is the key wherein we can contribute to our nation and make the nation sickness free. So right now this is the current module, and we are hoping to incorporate artificial intelligence into the same very soon, which would provide a healthy platform for a home-based healthcare delivery system. The client or a patient need not come to the hospital for various tests, because you already know which patients you want to call to the hospital. This will further on decrease the workload that we doctors have, so that we can deliver quality healthcare services to each and everyone that comes to us. Artificial intelligence system, along with certain voice analysis diagnostic apps, they are the future of preventive healthcare services. They are the future of medical healthcare services, and they'll be preventive in nature when we talk about them, implement them at the grassroots level as well as at the urban, rural, whatever the level is, whether it's primary healthcare. It's a long way to go for primary healthcare. We can implement them right now at the tertiary level, where we can diagnose. Of course, it's a different, separate class of clients that you need. You will be separating your clients from these clients, wherein the rush to the hospital would be decreased and quality healthcare services would be provided to each and everyone who comes. So it's a very detailed aspect. I've been given only 5 to 7 minutes to speak about it, so I've made my effort to be as short and precise and in this endeavor. And proudly to conclude, I would say that this complete system is entirely made in India, and we are very proud about it. We have taken no help from anyone till now. This system is going to many other countries, including Zimbabwe, we started, China, we have started, and people have realized the importance of preventive healthcare, utilizing new diagnosis tool, which we have named JV Scan for voice analysis. Thank you. Proud to be an Indian. Jai Hind.
The next award for Innovation, Holistic Healing of the Year 2019 from Chandigarh, and the winner is Dr. Mahesh. Hukmani, can we please have Dr. Mahesh on stage?